What is JULÄINE of Sweden?
So JULÄINE of Sweden is an extremely exciting new injectable product, and this is something that I came across last year and was invited to use, and it's probably been the biggest game changer that I've seen in the world of aesthetics for the last decade. So effectively, JULÄINE of Sweden is an injectable product, and it's a very long-acting collagen stimulator. Now, I know we've had many collagen stimulators in the past, and I've used all of them with good degrees of success. But I think this JULÄINE of Sweden is taking it to a new level because we're stimulating 100% healthy collagen within the skin. Unlike a lot of other collagen stimulators where we stimulate both some healthy and some less healthy or scar tissue collagen at the same time. So with this, we are 100% stimulating healthy collagen. So the net result is we're getting really natural results, long-lasting natural results. And this is really something that our patients are looking for, which is a reversal of the skin aging. Some of my patients are seeing such good results, they're calling it skin biohacking, which I think is really amusing. But this is a really novel new product that is delivering incredible results.
How does JULÄINE work?
So JULÄINE works, it's a collagen stimulating product that is injected into the tissues into the skin and to the deeper layers of the skin. And it works, it's a material that is injected called PLLA, or poly-L-lactic acid. Now that material has been around for many decades. In fact, I've been using it for over 15 years. But in other forms, in other products, one that's commonly out there called Sculptra. And poly-L-lactic acid is a very potent collagen stimulator. The problem is in the original forms of poly-L-lactic acid, it's often large particles that are irregular, often sharp and almost crystalline. And when these particles of PLLA are injected into the tissue, they can often cause inflammation. They stimulate inflammatory pathways, and that's a problem because that's producing the wrong sort of collagen as well as the lactic acid that's released producing the healthy collagen. So we could often find with repeated treatments that we're actually changing the collagen balance within the skin. We may be causing some stiffening of the tissues, which gets worse with time. We may have even overstimulated the wrong sort of collagen and end up with a lump or a nodule. However, JULÄINE is different because JULÄINE has something called Elastin Pro technology. This has been a decade in the making. The clever scientists of using the poly-L-lactic acid, but have made it into very tiny cell-sized particles or microspheres. Now these are no bigger than 50 microns, which you'd need a proper microscope to see them. So these smooth microspheres of poly-L-lactic acid do not induce inflammatory pathways when they're injected in the skin. They just stimulate the healthy regenerative collagen stimulatory pathways. So we're seeing predominantly all type 1 collagen, which is the collagen that our skin was born with, our tissues were born with. So we're reversing the skin aging. We're rebalancing with healthy collagen at all times. And I think that's the most important difference. It's the only product or only treatment that we have available. All other treatments up till now did stimulate some inflammation and inflammatory pathways, and we now know that's an increasing problem, certainly with some treatments. So I think this is an exciting development in aesthetic medicine, and I think certainly we're going to see a lot more of this in the future.
So what makes JULÄINE unique and so different from other collagen stimulating treatments and products?
So JULÄINE is a unique product because of the Elastin Pro technology. So this is where they've formulated the very powerful poly-L-lactic acid, which works through a low-level lactic acid stimulation. And lactic acid is our natural biostimulatory agent within our body. Our muscles produce it when we exercise to help repair and regenerate. So we know that low levels of this in the skin are going to stimulate healthy collagen pathways. And with Elastin Pro, the microspheres that have been developed do not stimulate inflammatory pathways. So we get a balanced collagen production, and we get a gradual change within the skin of a reversal of the aging process where there is increasing amounts of the wrong sort of collagen within the skin, a sort of thickening and a tightening of the collagen, which leads to sort of less elasticity and lines, wrinkles, and all of these things that we see in an aging skin. Not only that, but Elastin Pro technology within the microspheres will upregulate healthy pathways within the skin to actually reduce pigmentation, to reduce inflammation, and we've seen this in our patients. So it is the ultimate, I think, skin treatment to reverse the aging process and produce really natural results.
How long have you been using this product?
I've been using Galain. I was one of the first doctors to start using Galain in the UK back 6 months ago. It's going to be officially launched in the UK later in 2025, and it's been launched already in other countries in Europe. I was involved in the launch recently in Germany. So it's a new product, and there may be a lot of skepticism around trialing something very new, but it's using a formulation of a technology that using microspheres, which I'm very aware is the way to inject a collagen stimulating product. So it's new technology, but with an existing long-term product, which is PLLA, which has been around for many, many years. So I've got a lot of experience now, having treated quite a number of cases over the last 6 months. And likewise in Europe, there's increasing data being gathered around patients being treated in these countries.
What has been your experience so far?
So my experience so far with Galain has been very, very positive. So it's a pretty simple treatment with very little downtime for our patients and pretty painless injections. It's giving a change to their skin, which patients usually report as feeling within the first few weeks of a change to their skin and how it feels, how it's reacting. It's regaining the elasticity, the youthfulness. It's a very gradual onset of action and treatment, and continues for a long time. So over those patients that have had a number of treatments over the last 6 months have had a really positive experience. I think a lot of my patients are reporting that it's probably one of the most natural treatments they've ever had, and they're seeing really natural results. We're really reversing the aging clock in terms of their skin in all parameters, and some of my patients have referred to it as biohacking of their skin, so which is quite a nice way of looking at it.
What does a Galain treatment involve?
So a Galain treatment is we are injecting Galain, usually very superficially, just beneath the surface of the skin, and in most cases I'm using a simple cannula, which is a little blunt tube fed beneath the surface of the skin, and it's a very, in most cases, a currently comfortable treatment. Patients report very little, if any, pain at all during the treatment, which takes about half an hour to do.
What is the recovery period after a Galain treatment?
So injecting Galain can cause a small amount of swelling, and if you're really unlucky, maybe even a little bruise. Most of my patients, the swelling is minimal, and actually some comment on it as giving them an instant result. But we know that swelling is usually, in most people, very transient and is resolved within 1 or 2 days without any other action. In some patients, swelling can last a bit longer, but this is quite exceptional.
How many Galain treatments are needed?
So the number of Galain treatments that are needed really depends on what we're trying to treat and what we're trying to achieve. So in a younger patient, where we might be just looking to reboost the collagen balance and the elasticity and hydration of the skin, then maybe 1 or 2 treatments is all that's going to be needed. In older patients, where we may have lost a significant amount of collagen and volume and elasticity within the skin, then usually we advocate 3 treatments, maybe even 4 treatments in those patients. Spread apart by, we think the optimal time is about 6 or even 8 weeks between treatments seems to be a good interval. It could be longer and it can be a little bit shorter, but that's the sort of scheme of things.
When do you see the final results, and how long do the results last?
So when you've had a Galain treatment, the collagen stimulating process gets going after a number of weeks and continues for up to 3 or 4 months after the treatment. So if we're doing a course of treatment, it can certainly be 3 or 4 months later following the last treatment that we get to the final results. At that point, we know that the PLLA and the Elastin Pro technology is usually within the tissues for up to 2 years. So it's maintaining that result for long periods of time, which is very different to a lot of other treatments that we do that may stimulate some collagen for a shorter period of time, maybe months, 6 months, a year if you're lucky. This is going to potentially give a much longer lasting result of treatment.
Can Galain be used in conjunction with other treatments?
So Galain certainly can be used in conjunction with other treatments, and we often find, dependent on the aging process and the patient in front of us, that often combining different treatments, there's a synergistic action, and we may be treating volume loss with maybe a different type of filler or a different type of collagen stimulator. We might be further treating the skin to reduce inflammation, to improve collagen production, perhaps using LED phototherapy like the Dermalux, or trying to speed up the rejuvenative process, maybe using a skin resurfacing procedure like Tixel. But in our clinic, we tend to be combining it primarily with LED phototherapy, and of course Botox, and maybe some of the other fillers if needed can be combined. Usually not on the same day, but certainly within a treatment program.
What areas of the body can Galain be used?
So really, Galain could be used anywhere in the body where we want to stimulate the change to skin and reverse some of the aging process by boosting collagen elasticity of the skin. So we're typically using it over the whole face, and that includes in the delicate areas around the eyes, the periocular areas. We're using it in the upper lip to naturally lift and tighten the lip without volumizing the lip, because many of my patients fear volumization, over treatment with fillers, puffiness, and the unnatural results that we can often see, and certainly in the wrong hands with the use of fillers. And with Galain, that's not a risk. We're actually much more naturally rejuvenating and giving people better, healthier skin to look their best for the age they're at. It could be, we've used it extensively in the neck now and the upper décolleté. We're going to be starting to use it in the backs of the hands, and I'm sure other areas of the body like the upper arms and even the legs and the abdomen, if we're trying to change the skin. These are all areas that will respond to Galain treatment.
What is the difference between biostimulation and bio-restructuring?
So there's a lot of talk these days around regenerative aesthetics and what is biostimulation, and there's a new term come out which is called bio-restructuring. So I've been using treatments that do work through biostimulatory pathways for several decades, and this could be anything from microneedling to chemical peels to injectables or such. And basically we're often using a chemical or using a trauma to induce a healing response. But we're often then triggering a healing response that involves inflammation, inflammatory pathways. So if we have a trauma, there was inflammation, and that will set off a healing cascade. Now, in the skin, we have to be very, very careful, because if we set off and we have too much inflammation in the skin, we all know that that will set off an abnormal healing response, which may produce too much of the wrong sort of collagen, the collagen that is effectively scar tissue collagen, and may even destroy some of the good collagen in the process of that repair. So we can slowly change the balance of collagen with the skin, which can lead to stiffening, tightness of the skin, which may in some cases give a nice result in the short term, but could in the longer term result in contraction and deformity of the skin and tissues, and it feels stiffer, it feels different, and looks less and less natural as time goes by. So if we can stimulate the healthy pathways and restructure the skin in a healthy way, and this is what we're now terming bio-restructuring, without stimulating inflammatory pathways, then we're going to end up with more youthful tissue that feels and looks better, and that's what I think a lot of my patients want to achieve now.
Who are the ideal patients to have a Galain treatment?
The ideal patients for a Galain treatment are of any age where we want to boost the collagen and elastin of the skin. I think in my experience this may well be patients in the sort of 40 to 60 age group, who tend to be the patients who are noticing most of the changes in their skin, whether it's laxity, lines, wrinkles, volume loss. So these are going to be a lot of our patients. However, we have treated some patients in younger patients. We're often dealing with other things that have damaged the skin, inflammatory problems like acne and rosacea that may have changed the skin, with scarring and open pores. And in those patients, we can really reverse those changes with the use of this product. So I think it's going to be used across all the age ranges, but I think predominantly when we're talking anti-aging and rejuvenation, then I would have thought the ideal group. But I don't think there's an age limit either. If somebody's healthy and they're in their 70s or older and they have a good nutrition and healthy body with low levels of inflammation, then I can see them responding equally to this product, and I don't think there's an upper age limit.